Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Mythri Shankar with us today. Hi, Dr. Shankar.
Hi, Shilpi. Nice to be here.
Nice to see you too. I love you having your chapter in the book and everything that you've done with this book. And then your other book that we see in the background, Ease. We're going to talk about that in a minute. Go ahead and tell us a little bit about yourself.
Well, I'm a nuclear medicine physician. I was practicing in LA, trained at the Wadsworth UCLA program, 2001 batch, and I've been doing nuclear medicine for the past 27, 28 years now, initially in the US and more recently in India. So we in nuclear medicine, we basically do, gamma imaging, the heart scans, the thyroid scans, and almost every organ system can be scanned. And PET-CT, mostly for cancers, and we also treat the theranostics part. So that's me. More recently, about 3 to 4 years ago, I was diagnosed with diabetes, and that's when my journey into the lifestyle medicine space got started. I was trying to figure out if there was any way I could avoid medications and control my sugar levels. Turns out you can. So I got board certified in lifestyle medicine and more recently into functional medicine as well. So that's me, mainly nuclear medicine, which is functional imaging, and also both certified in lifestyle medicine and functional medicine.
You answered my next question already. Thank you so much, which was how you got introduced to lifestyle medicine. So let's dive deeper a teeny bit. How did you feel when you got diagnosed with diabetes, and how did you come to find lifestyle medicine? And what did you feel when you found lifestyle medicine, and what you said that you can actually treat and reverse diabetes with lifestyle medicine? Tell us a little bit more.
Yeah, I think it was like a bulb on moment. I think my sugar was where borderline kind of, but it got to a stage where I would have to be on medication. Being in nuclear medicine, we very closely interact with these specialties, especially the endocrinologists. So I have spoken on national and international forums for them and quite networked with the best of the best in the industry. And but everybody gave me the same prescription, the same dosage, the same timings, and they said, take this for 3 months. If your sugars are not under control, we will increase the dose. That's how it was. And so I looked up the tablets and then the side effects and such. One of them was bad taste in the mouth. I could even taste it even before I started the medications. So that's kind of how it started. I was, I think everybody does that. They want to see if that there are other alternatives or if there is something we can do to avoid medications. And the more I read, the more I was surprised and was like, why weren't we taught about this, or how come all this was not general knowledge to my own specialist? And that's how my kind of journey started. And the more I got into it, there is so much mounting evidence also to substantiate it. And I was kind of convinced, and I said, okay, I'm going to give it 3 months or 6 months or whatever. I'm going to try it, test it. And my hemoglobin A1Cs were 7.8. And being an Indian, South Asian, our BMI cutoffs are different. I used to think I am, normal weight, but I would think I was kind of bordering. If you look at the cutoffs for Asians and more so Indians. So a lot of things started to match, and I was able to kind of make those correlations and understand the grain hierarchy and try to get away from rice and, the whole 9 yards. So and all those changes I made started to reflect on my sugar level. So it was like validation itself. And it works. So I think that was once I was convinced that yes, this can work and it is working for me, that's when I started to put the other parts of the puzzle together. In nuclear medicine, we deal with a lot of cancer, which is also lifestyle disorder. We do a lot of cardiac scans, myocardial perfusion scans, before and after the stent, things like that. It turns out that is also, in a way, reversible. So I think kind of made me realize I have been in this center seat of diagnosing and kind of giving out reports on all these lifestyle disorders. And until I was diagnosed with another lifestyle disorder, that's when it kind of made me feel, okay, this is what I want to be working on with a better or a higher focus, finding my ikigai, if you will. So, yeah.
Yeah, you taught me that word. I had not heard it till I read your chapter. Do you want to explain it for our audience?
Uh, I think I'll let them read it. It's a Japanese concept. It basically means your reason to be, and it is four circles, when what you like, what you're good at, and what can make you money, and what you truly want to pursue. All those things, kind of the subsets, when all of them converge, and you find something which gives you or taps into all of those kind of things. uh, that is, I think, the meaning or purpose of what you want to be. And that made so much sense to me, because now this is what I want to be doing, not just for myself and also for my patients, in prioritizing health, in a very holistic, natural where you are in the driving seat, where you control what kind of things you eat, or how you exercise, or your sleep patterns, or basically habits. So much of what we do influences our health. So it kind of gave me that perspective, if you will.
I love that. And I think we're all searching. I'm so glad you found yours. I think hopefully we've all found ours. But tell me how you incorporate lifestyle medicine into your practice with your patients, because I know you're still practicing nuclear medicine. And then tell me a little bit about your book. I love it.
Yeah, it's a busy practice. About 60 to 70% it's mainly cancer. At different stages of cancer, before treatment, after treatment, kind of like that. So one of the reasons I wrote the book also was to be able to help my patients. Not all the time we have that much bandwidth to of in time wise, to go through with the patients all the things that they should be doing to bring in those changes. And more and more recently, we are seeing cancer in patients with absolutely no risk factors, healthy males, no non-smokers, lung cancer, multiple examples like this I can give. And one of the commonest questions I get is, why? What is going on? And that's when my research internally started. And the more I read, the more I was overwhelmed with the evidence, which kind of correlates the carcinogenic burden, be it in the food or the lifestyle, multiple things. It's an entire chapter in the book also, how much of the toxin exposures we are exposed to in different verticals, and what we can do to kind of bring that down. And every time, if we have a heart patient or if I have a diabetic, I do take in some time to explain to them. But it is, the book has all the information, but for the transformation to happen, I think it takes more than that. They would need, it's a long process. So we do try to make that initial connect, and kind of bring in that awareness that there is so much power within them, and change is something which can make that transition happen for them.
And you're providing them hope at a scary time and telling them that there
Yeah.
is ways that they can change. That's amazing. I'm sure they're so grateful to you to know your expertise and read your book. That's amazing. So the book is called Ease. We see it behind you. It's available on Amazon and other book sale products or web pages, I should say. And then we have your chapter in our book, How Healers Heal. Let's talk a little bit about our book. Why do you think doctors or non-doctors or patients should read our book, How Healers Heal? Of course,
I
they
think
should
it's a
read your book
beautiful
too.
book. I love the title. I think it's important to healers to come and speak about it, and also the people who are seeking healing to understand what is the process that we are going through in delivering this mode of healing. The book, it's actually, it opens up a perspective. I've seen some of the chapters from my other co-authors, which you have done a brilliant job of collating and bringing everybody together, and it's amazing. I'm thoroughly enjoying it, and it kind of has made me feel that I have found my tribe. You know, it's like we are all saying the same thing, coming in from such diverse backgrounds. So I think that doctors should read because it gives them that perspective and they learn from each other. In a way, we are all like soldiers, trained, to follow guidelines and protocols, and with the best of the best, and in a way, pursuing specialization, which is knowing more and more about less and less. And sometimes we forget the basics, perhaps, lifestyle medicine, that should be the basis of the foundation. It should be the foundation of every medical system. I think it brings in that perspective for doctors, and for patients to understand the journey of such doctors. You can actually walk with a doc, and not just follow the orders. Kind of gives you a peek to the behind the scenes, if you will. And once that connection is made, or that coherence of frequency happens, I think you start seeing your physicians as a coach, or as a friend. And in that person, you can find the knowledge who can help you to make those kind of necessary changes. So I think it's a great book for people who are healing and who are seeking to heal. A must read, really. Yeah.
Thank you for that. I think you're saying what's happening in all of medicine, but lifestyle medicine is a tool to help that happen. What you said was having the doctor and the patient basically become partners in their healthcare, which is what we've all been aiming for the last 20, 30 years, instead of a patriarchal approach where the doctor says this and the patient has to do it. So yes, and then patients can see that we're human too, and we have all of these same health challenges, and how we've been able to overcome them using the tools from lifestyle medicine. Thank you. I love that point. Switching gears a little bit more, what's your number one tip for self-care or making lifestyle changes while they're waiting for their copy of your book, Ease, and our book, How Healers Heal, to come in the mail?
I think, change, that's the only constant, I think. And when you replace the I in illness by W, it becomes illness. When you put in we into I as a team, the patient and the doctor. So that is the change you would also want to do in terms of perspective. Very important to figure out the why in what makes you cry, and that is which propels you towards change. Why is it that you want to change, and what are those changes going to bring in the benefits that you seek in your health? It's and a lot of this is in sometimes it's common sense, and there's enough research to prove it also, that lifestyle, what you eat is what you are. And all the 6 pillars of lifestyle medicine, how significantly they can affect health. And there's no really, we are not trying to invent anything here. It's all known and proven. We just have to focus on implementing those kind of changes. At only which time we can stop unnecessary medications, no, not medicate, but in a way perhaps eradicate some of these lifestyle diseases. And the recent trend also has been to deprescribe, bring down the type and the dosages of unnecessary medications. We commonly see now recently, patients who are diabetic, they are on insulin, the dosage of insulin comes down, or if they are on 2 or 3 medications, that comes down to 1 or 2. And if they were on a small amount of medication to start off with, many of them have successfully stopped taking those medications. And all this we're able to see this only when they have made those kind of changes necessary in the lifestyle. And each disease spectrum calls for a different set of changes, and that's what the book is, which is basically you're taking out the dis part in disease and making it is. So that's how the name for it came about. There's one chapter on each disease. Like for heart disease, there's a chapter, and in the end of the chapter, there is a summary of what changes in the order of priority would truly help them benefit. For heart disease, I think the focus is more on salt and so on and so forth. And for diabetes, the carb load and the glycemic index, how would you control that? And for cancer, focus on plant-based diet, things like that. For it goes on and on. So kind of prompting them towards what changes which are needed, which would benefit for them in particular, rather than giving them a whole list of so many things, which will also be helpful. But out of that, prioritizing, making it, if you're having this, then what would be of most benefit to you in that way. So yeah, I think change is the only constant, and small changes, one small change, one small step, baby steps is the way. It's a process. It's not going to happen overnight, but if you have the will, there's definitely a way.
Thank you for all of that. I loved everything you said. I'm going to have to listen to this again. So you said illness to wellness, and then medicate to eradicate, and deprescribing, which is a huge concept that I just love that lifestyle medicine is promoting, and you are promoting. And then the disease to ease with your book. It's amazing. We're going to have to read your book and listen to tips and read this book, How Healers Heal. Thank you so much, Dr. Shankar, for all of these just pearls of wisdom and for helping everyone. Is there anything else you'd like to share or want to talk about ways to connect with you before we wrap up?
Yeah, sure. I'm on LinkedIn. My email is out there. The book is on Amazon. We have a YouTube channel. I also run an NGO. We've been doing a lot of wellness-related, eco-friendly, sustainable, healthy practices. That's based out of Bangalore. So happy to help and chip in, and connect and answer questions if any. Okay.
Oh, yes. And please tell us, where are you located most of the time as well for your clinical practice?
Yeah, I'm based out of Bangalore, and the details are on the website. And I'm also the book is on Amazon, and I'm on LinkedIn. I think that would be the best way to connect. And shoot me an email.
All right, awesome. Thank you so much, Dr. Shankar. Everyone can check out her book, Ease, and check out our book, How Healers Heal, and her chapter in this book. Thank you so much for being a part of our project. I appreciate it.
Thank you.